Hello, everybody. I'm Paul Mears, Chief Executive at Cwmtaf Morgannwg Health Board, and I'm the Chief Executive Lead for the Chronic Disease Transformational Shift, a part of the Community Design Programme. I'm here today to talk to you about Community by Design and particularly the chronic disease work that's currently underway. And the Community by Design programme aims us to help create a health and care system that better meets the needs of people and communities across Wales. And within this transformational shift, we've been exploring how we address a specific challenge facing the system. This is our emerging care model for chronic conditions management, and it represents our current thinking based on the work we've undertaken so far. It's not the finished solution, and we're now moving into a phase where we want to test and strengthen the model through wider engagement. We'd really like some feedback on this emerging model, and we're particularly interested in understanding what's strong about it, what you like about it, what will help enable this work in practice, and anything you think we need to be considering when we're thinking about chronic disease. Your experience and insight will help us strengthen the model before implementation. There are a couple of models that we're describing here, one of which is the single condition model. So if somebody living with a single chronic disease, and then you'll also note that there's a model which is being designed around people who have multiple chronic conditions, recognizing the interdependencies that those models have. So what we're really keen to think about from you and get feedback on is what elements of this model are particularly strong. What do you think are good? What do you think are relevant in the areas that you work in? What will help enable this to work in practice? We recognise that moving to a more standardised approach to these models of care for chronic disease is going to mean a lot of change for many professionals working across the healthcare system. So what do you think will help enable this to work in practice from your perspective? And finally, is there anything important that you think is missing or something you think that needs further consideration with regard to these models? This is the emerging care model for the chronic disease management transformational shift, and it's not the finished answer. We know that there is lots of work already going on in this space across Wales, in NHS organisations and across the wider health and care sector. So we're really keen to make sure that we capitalise on the knowledge and experience that many of you will have already of working in this area of work. So we're really keen to hear from you to get feedback on what you think the model is looking like already, but also most importantly to get your thoughts and perspectives on how it could be improved and added to make it really relevant for the people you're looking after, but also to recognise that what we're trying to achieve here is a model that is applicable across the whole of Wales. So there's a clear need for us to design a model that is consistent, so we get a consistent set of models across Wales, and that the outcomes are consistent, most importantly, because we know there are already inequities and inequalities in the way in which care is being delivered, and indeed the outcomes that people are experiencing. So what we're trying to do through this work is get a model that is consistent across Wales at a level of specificity that is clear enough to be understood by everybody, but also a model that is able to be adapted and modified for the particular circumstances of a particular health board or region or cluster, to make sure it responds to the particular needs of those communities that those professionals are serving. So this is not trying to micro-prescribe to the nth level of detail from the centre about how care will be delivered. It's about designing what would good care look like, what would a good model of care be looking like for a single condition, long-term condition, or indeed a multiple comorbid patient at a high level, so that we can then take that and interpret it at a local level for our communities and populations that we're looking after. So it is the opportunity for you to now give us feedback on this, to help us strengthen the model, to help us understand the challenges you see around implementation that we need to be mindful of, and making sure also that it's practical and credible to be delivered. I'm really keen to get your thoughts, and you can do that by completing the linked MS form that is available to you on the engagement portal. And I really look forward to hearing your feedback and thoughts on how you think this model can evolve and develop, and most importantly make a positive impact for the people in Wales that we're serving. Thanks very much, diolch yn fawr, and look forward to receiving your responses.